Well, happy, beautiful, amazing day. Dr. Bob Rakowski here with my newest friend, Dr. Ken Rowe. We're looking at a guy that has 35 years of emergency medicine, over 170,000 patient visits. I have a hard time wrapping my head around that. But I'll tell you what I love most. It's what I'm looking at right now. Here's a guy my age with a medical background working his butt off for decades that still looks good, feels good, and wants to make the world better. So, Dr. Ken, welcome to our podcast. And we're going to have a conversation about midlife and why it may be the biggest issue that's not being talked about, and maybe even why it's not being talked about.
Well, thank you very much, Bob, for that super nice introduction. I appreciate that. I've been blessed with good genes as well, so I have to really give my parents a lot of credit on that. The Korean genes are really amazing, obviously, for complexion and skin. And I didn't realize that growing up, but I realize that now. It's super nice. But anyway, yeah. On that point, I do think it's incumbent upon us as physicians and medical professionals to practice what we preach. I mean, it's very important. You have to understand that a patient will look at you and just kind of, you know, regardless of whether you think it's right or wrong, um, you know, communication's 93% nonverbal. So they might not even hear what you're saying. They're just going to be sizing you up, and it's like the same thing. You have a child, and you speak the same words to your child, as far as advice, and then they hear it from their uncle or their pastor, and it's the same words, but different voice, and they incorporate it. You're like, I've been telling you this for 5 years, but it's kind of the same concept. I think it's very important for uh, the medical profession to embody health and to represent health, because we're healthcare professionals. And I think that's part of, I'll use that to segue into what our conversation is titled today. Um, Midlife is medicine's um, biggest blind spot. So I'm going to start with a couple of things. First of all, the midlife crisis. Let's kind of just reword that, because all it is we just think about the guy that's getting a sports car and getting a 20-year-old girlfriend and having that kind of midlife crisis. We're not talking about that. We're actually talking about how midlife is a crisis. We certainly know how much of a how much of an issue it's been for postmenopausal women. I mean, they are, if you really want to narrow it down to the biggest crisis, I mean, that's medical gaslighting. I mean, for postmenopausal women, you know, by the way, this hormonal therapy that was going to help you, we're going to black box it because it might cause cancer. And then thank God they finally removed that about a month or two ago. But that's, you're talking about a lot of suffering and a lot of, you know, improper communication. I mean, gaslighting is pretty serious when you just say it's okay, it's all in your head, you'll get through it. And then women try to reach out to their mothers or other older women. And what's the message? It's going to be the same thing. Suck it up, buttercup, right? And then you're going through all these incredible hormonal changes. I mean, imagine us, Bob, you and me, all of a sudden, over a 6-month period, all our testosterone is gone to, like, we go to zero.
No, thank you. No.
Yeah, no, we would be in the psychiatric hospital probably. But you have to look at that as probably a blind spot. But I think midlife overall, um, for
Well, I think
for
less so with women, right? I mean, women have a very obvious transition. I think more of it being blind, almost literally blind for men. But let's talk about both. Who do you want to start, men or women?
Well, we'll talk about men now, and then we can always go back and forth because there's a specific spot where women can help men, obviously, because they see the changes in the men first. But as far as women, they have a change, they know it's coming, and women are just naturally more oxytocin. They'll be more. They'll have better support. They'll reach out. Um, one of my articles that I posted for LinkedIn, I talked about the biggest risk factor in middle-aged men is not hypertension, it's not smoking, it's not obesity, it's silence. So if you don't even, and it's astounding. Women will go for their annual physical exams and they'll go for their mammograms, they'll go for their testing. Um, Men, it's amazing. A man can go years without ever seeing a doctor. I mean, and I think typically the men that I see in the ER, the ones that are going through their unstable angina or coming in with their big heart attacks or something critical, strokes, honestly, these are the guys that haven't had medical attention for years, and so it's silence that is the biggest risk factor. Um,
Well, Doc, let's just bridge from that real quick and come right back to it. What percentage of those guys in the ER between 40 and 60 that you're seeing wouldn't be there if they were not silent and had good guidance in terms of their health?
oh my God, I mean, we're talking about if you want to correlate it to say metabolic dysfunction, um, and if you want to say the statistics show we're talking about 80%, maybe even 90% insulin resistance
Wow.
across the board. And if you just kind of take that 90% and kind of overlay that with guys who don't really see their doctors effectively, or even if they see their doctors, what sort of therapeutics are they on? Are they on anything that really move the needle? Um, and are they compliant? And do they have a peer group that they hang out with that are gonna support them, or is it gonna be a good old boy thing where we're all gonna go barbecue and play golf and drink beer on the weekend, and we're not really gonna be, we're not gonna be jogging or going to the gym or anything like that, or keeping ourselves, accountable for, our body composition or for our hemoglobin A1C, etcetera. So, at least 50%, but I think my guts tell me that the percentage is gonna be higher. And that's the conversation that we wanna have because, the good old times, one of your good advices is always an ounce of prevention's worth a pound of cure. But, we're we're in this phase of medical technology that, we just wait for something to happen before we do anything about it. So, all the technology is about, procedures, which have been astounding and really have influenced and increased life expectancy, but, hasn't really done anything for health span. In fact, it's made it worse because people are living longer now because they're getting stents, because they're getting acute stroke care. These are the people that would have passed on if we didn't have this new technology, but at what cost? What's their lifestyle like? It's like, have they, had a come to Jesus moment and just said, "All right, well, I'm gonna change everything. I'm gonna eat differently. I'm gonna exercise. I'm gonna really concentrate on my health." And maybe that might last for a little while, but it doesn't, obviously, it doesn't last. Um, and population studies have bore that out. So,
I want to jump in with a few comments because most people are going to understand what you said about lifespan, health span. But lifespan, that's how long you live. Health span is how long you're healthy.
yeah.
And here's a fact: in this country, the average American spends their final decade with a major medical disability taking five or more drugs. And if we go back to the blue zones, these people live to be 100. 80% of them are still having sex on a weekly basis,
Yep.
which, let's think about that for a moment. And they have good community. So, women, listen, biologically, they're not as strong as males. And believe it or not, not as resilient, but they live longer because they're stronger emotionally, have a better community. Use the term oxytocin straight up. I mean, that's the cuddle hormone. They're wired to be nurturers and to get nurtured, whereas we guys, we think we need to tough it out.
Yeah.
So, you also mentioned unstable angina. That is not being silent. That's someone's body screaming at them, and then they show up with an MI, and now you got a 50-50 shot of bringing them through the night.
Yeah,
So,
exactly. Exactly.
now what? What let's talk about some of the earlier messages maybe that their body is giving them that they're not quite hearing. What are some of the early things that they can pick up on?
So a lot of it has to do with their identity, and a lot of it has to do with their operating system and how they think. Because, quite frankly, we get, I'll talk as men in general, everybody's different. But, we go through puberty, it's a tough time for us. We're trying to, you know, um, there's only a few things on our mind, probably one thing on our mind.
One thing.
And then
For the
yeah,
most
and
part.
then so, we take that locker room mentality, with us. Along that comes, the testosterone, the maybe the competition, maybe the striving, the success mode, and that mode that we acquire when we're in our 20s, and if we're successful with it, that I don't unless it gets reprogrammed, I mean, our brains are not like our iPhones. We don't get automatic operating system updates. We get stuck. We're stuck in DOS. When OS is running OS, 26 now for the new phones. So I mean, so we're stuck in this. Be a man. Don't talk about it because that shows weakness. And don't look like a weak man. Um, because you're supposed to, tough it out. You can sleep. I can sleep when I'm dead. It's like all the things that you hear. I want to chase success. I want to be successful. And, we've got a couple of really good authors that have talked about this, David Brooks, The Second Mountain, Arthur Brooks, from Strength to Strength. We have a lot of data. Jonathan Hausch, I think is the last name. He talks about where happiness is peaks in your late 50s. Because it's kind of nice that I mean, I don't know any of a 60-year-old guy that wants to go back to being 18 with that. It's just like no. If
You might like
maybe
that mentality, but not the challenges, right?
exactly, exactly. I mean, maybe the energy level, but not the naivety and the flat out ignorance. I mean, we just didn't we were, like, unconsciously incompetent, right? We didn't even know what we didn't know. So, that's the problem. We get stuck in that identity. That's the identity, and then you get older, you become successful, you have a family, you're, success in your community, but, the funny thing is your mindset has never changed. So, wanting to be vulnerable, wanting to open up, wanting to seek care when you know that, maybe that little I just took a walk to the mailbox and I started getting sweaty. It wasn't even hot. Or I'm getting a little bit short of breath. Or, certainly we can you mentioned it, erectile dysfunction can be a definite sign of cardiovascular disease because it's about blood flow, um, and also about metabolic syndrome as well, because that affects everything. But everybody just kind of, every guy will accept the dad bod. He's going to accept being a little bit, thicker around the middle. Just gonna accept that. Oh, he's going to be a little slower and have brain fog, and nobody's really talking about you. Those are the things you don't really should be accepting as parts of aging. Um, when I was growing up, I actually idolized Jack LaLanne, because he was just so amazing, and he just broke the age barriers, and he just broke all the stereotypes of what you should be able to do, and we all know what happens when that happens. Roger Bannister breaks the 4-minute mile, and then within a year, like, I don't know, 30 other people have broken the 4-minute mile because there was this mindset that said it's physically impossible for a human being to break a 4-minute mile. Well, it wasn't. So, that's the mindset that's going on now. It's to be 60 years old as a man, you shouldn't expect to be able to have a certain amount of energy or a certain enthusiasm for life or a certain body composition. And that's just completely, completely false for men and women.
Well, society's kind of dumbed down the standards. So when we start talking about influence, one of the things you and I were talking about, there's plenty of people on social media that they look good on the outside, but they really don't have any substance to share. but somehow, some way, people are taking all their advice maybe to their detriment. So maybe we should talk about how does someone find a good guide in terms of their health? Because there's no limit to people offering advice.
Yeah, it's you have to really, it's you have to really do your diligence. I mean, I think the best resources personally are, functional medicine docs, integrative docs, precision medicine. I mean, I trained internal medicine and then I worked ER and I've been a hospitalist. And certainly internal medicine should be that either internal medicine or family practice. Primary care should be that uh, doctor, but they're so limited. They have to crunch out a time schedule. They have 15-minute slots to see patients, and you're only going to get one wellness visit a year, so they're very limited. There's a huge gap there that should be filled in, and I think that's why a lot of people are reaching out to influencers and AI to try to fill those gaps, and then that can be very dangerous because we've all we've done it ourselves on a subject that we didn't know. We use AI, and then it's like, you totally we say I was trying to fix something, and it blew up on me because AI told me to do this, and it was completely wrong. And, it doesn't have any feelings. Well, okay. Oh, okay. Oh, that didn't work. Yeah, yeah, it didn't work. So, but when you're playing around with your health, you don't need a potential hallucination from AI or a misunderstanding from a incorrect prompt, or Google or influencers. You need something that works for you personally. So everybody's different. Everybody has different genetics. Everybody has different issues that they deal with. So, someone who can look at your health from a holistic point of view and also be able to follow up very frequently is key. And those people are very rare to find, very rare.
Quick commercial break brought to you by bettercoffeeshop.com, the world's cleanest organic coffee. One of the changes Dr. Ken's talking about is the drop in testosterone, the increase in cortisol, the stress hormone. The herb in our coffee, Ganoderma lucidum, also known as reishi, improves the testosterone cortisol ratio in both men and women. Best, cleanest coffee in the world, 3 years running. Bettercoffeeshop.com. So, Dr. Ken, so now we've got these people getting out there and trying to tell people what to do, based on maybe something that they read. And some of these people aren't even real. Someone sent me something that really scared them. I swear it had to be an AI generated female medical doctor. She looked good, she looked pleasant, and she was giving the worst advice ever.
Yeah.
Are you seeing people coming in being told some really off the wall stuff? And how can we teach them to be more diligent?
Yeah, I definitely am. I mean, it is kind of funny though when you think about it because you think about the outreach. Like, how many of us have heard of Tai Chi walking? Right? I mean, that's like a huge thing. That's complete AI. Those are not real people, completely AI. Um, but they talk about and of course, because it's completely AI, then it really doesn't have any sort of meat when it comes to whether or not it works. I mean, walking in general is fine, but they catch a little niche. They do some AI. I think there's another one where it's about um, you know, um, cognitive memory and, that's a real, I'm 57. It's funny how I'm talking about 2 Asian AI ones because I guess those are the ones that come up in my feed a lot, but, people it's just completely saturated, with it, and, you really have to take things with a grain of salt. You have to run it by somebody who is trusted, who has experience, and I think you know that's the kind of influencing that I wanna be doing, not on, like, a grand scale, but just on a more this is a physician who's been seeing patients, who can kinda give you what's right, what's wrong, or what's still uncertain, and give you kind of, an understanding of it. I did wanna put in one word about, peptides. There's this big everybody hears that word and they get different reactions. First in a lay person reaction would be like, okay, peptides, that we're talking about. All right. So non-FDA approved, um, on the fringe, kind of fringe medicine. We have to have lay people understanding that when we say what a peptide is, which is an amino chain sequence specific, usually short, that creates a specific biological response. We're talking about insulin as a peptide. We're talking about tissue plasminogen activator, TPA, is a peptide. Growth hormone is a peptide. And of course, all the GLPs are peptides. So when we're talking about peptide therapy, we've been using peptide therapy for a long time. We just haven't been calling it peptide therapy. So when they hear about these other peptides, everyone automatically thinks, oh, these are really bad. And if you really do some research, deep dive, and if you use a reputable compounding pharmacy that passes all the regulations, and particularly if you get these sourced through a um, physician or medical provider that can source these peptides, then you're talking about things that are overall safe to use and certainly worth looking into.
I want to talk about delivery because there's plenty of people trying to do oral peptides, and certainly the digestive process is going to change that a little bit.
Absolutely.
There's a nebulizer way of delivering it, and then there's certainly injectable.
Yep.
Want to talk about the pros and cons of each? Have you had any success with the oral peptides or your own injectable? How do you do it?
I have had success with oral peptides, but not as much success with as with injectables. Quite
Well,
honest.
that's what makes sense, right? Just
Yeah.
for the ants, you
Yeah.
swallow protein, and a peptide is a protein, a small protein. Your digestive system is going to alter it before you absorb it. You shoot it
Sure.
straight in the bloodstream, you get that benefit.
Yeah.
Um,
Exactly.
Everything with nebulizer.
Well, nebulizer, nasal spray. I've had some very good success with PT-141, which is for it's for hyposexual disorder. It works great in women,
Okay,
um, and it also works great in guys too.
what's
Um,
the mechanism?
it works on the central nervous system. It actually works on in the brain areas that that cause arousal. Yeah,
God, that's fantastic. I want to go back to way back to our old day when they had Dr. Ruth Westheimer, and I was 12 years
yeah,
old. I couldn't wait to hear what the crazy German doctor was saying about sex, our favorite topic at 12. But she said the most important sex organ is the one between your ears.
absolutely.
And if that peptide works for that, and this is new information for me, man, that's awesome. How wonderful that we can actually improve, intimacy by getting the brain right.
Oh, yeah, absolutely, and there's some combinations too. There you can combine PT-141 with oxytocin and, deliver that in a nasal spray. It works amazing for men and women. So, I think that's like, a very beneficial, safe, and, it's a very nice way to kind of, get some of that, get some of that intimacy back. As you talked about how, in the blue zones that they're having more, um, sexual relationships, which is great. I mean, it tells you a couple of things. I mean, it certainly tells you about, um, community and love, but it also, is a thumbs up on the vascular system. You've got good blood flow, so it's a good thing. I mean, you want blood flow all over your body. That's exactly what creates health. Um, but slowly and surely over the years, that will get diminished by metabolic dysfunction, by atherosclerosis, by fibrosis, and by inflammation. So yeah, you kind of it's nice though when you talk about um, when we're talking about longevity um, and preventive medicine. We're not throwing all this stuff in different silos. This is all the same thing. What we're trying to do is we're trying to improve health span. And you can call it longevity, you can call it precision, you can call it functional, you can call it integrative, you can call it preventative. I mean, it's all in the same bucket. We want people to be healthier for longer. We don't necessarily want people to be living to 150. Maybe that's what, let's say Brian Johnson is kind of wanting that. Um, But we want people to be in their 60s and 70s, enjoying their grandchildren, getting outside, walking, enjoying traveling, hiking, going to visit the national parks, and just, it's funny. You don't want to create a situation where you have that learned helplessness. You get older, and then you just put a big barrier around yourself, and you just say, "Well, I can't really fly out of this barrier. I've got to stay stuck in my box." And because then you start talking about how that affects you emotionally, um and your freedom, and like you're getting too old to drive or something like that. All of a sudden, you're just shrinking up, and that just causes all sorts of psychological issues where you're not thriving. You're not waking up in the morning going, "Yeah, right, yeah, I'm I'm alive for another day. So let's make something happen today, something good."
Let's go back to the theme of silence in this midlife crisis. So we've got men, they start declining, they start noticing a few things. As you said, maybe their wives notice it a little ahead of them.
Yeah.
So, what's the first step for them? Who do they talk to? Should they be talking to their buddies? Should they just realize, okay, this is not normal? How do they even know that? Give me steps one, two, three to work their way out of a funk, and hopefully preferably early, and then maybe even late. Let's say someone comes in 60 and says, okay, I'm really broken down. My life isn't what I want. So let's go with 40 on the decline and 60 declined and give them some tip.
Well, number one, I think your buddies are going to be your best source. And it's not something that you really have to set them up with, because it's going to be something where you just have to be vulnerable. And you know what happens if you're with a group of guys, what's going to happen. The guys are all going to say, "I know exactly what you're talking about. I'm feeling the same thing." And then you just have this momentum where you can, you know, talk about things. And they have a nice movement in the UK called the Men's Circle. It's like, here in the US you have to be in a 12-step group to get kind of the same kind of support. But in the UK, it's just guys getting together talking about, guy issues. And it's so, it's great where you can just take off the armor, leave it at the door, talk about vulnerable things, be vulnerable. And then, but the key is from there is if you're in a relationship, or, if you're married, then really running it and having a nice discussion with your spouse. Very helpful. That's very helpful. Because typically, so a guy talking to, let's just say it's with a woman, but I mean, it could be another guy too. But he comes home to his wife. His wife, oh no, his wife would probably had a stroke by, "My man is actually being vulnerable. Where did this come from? What's going on here?" But to have that powerful conversation and actually bring it up to your wife without her bringing it up to you is something that is so powerful for a relationship, because, it's like, if you just come up and say, "Hey, I've been thinking about something for a while. I was wondering if you could help me out with it, or what do you see?" Uh, wow, you're just gonna get, none of us have enough honest, connecting conversations, with our spouses. I mean, we get busy, right? I mean, most of it's transactional, most of it's scheduling, most of it's like, "Hey, hi, bye. We're gonna split up the duties," particularly when you have kids, and grandkids. So, things are just gonna be more of a transactional issue rather than what's going on with you and what's going on with me, like as people. And I think that is kind of the bridge that can lead to seeing a physician or seeing a medical professional, and getting the right tests run and the right diagnostics and the right follow up. It's the whole key. Uh, and it's something, Bob, we're missing all those pieces in medicine. We're missing the physician to actually see the patient, and then we're missing the diagnostics because, let's be honest, we're just doing CBC, Chem 20, lipid panel, and following guidelines that are just the guidelines were made for healthy people in the 70s and the 80s. They weren't made for 2025. or 2026 now. My goodness. So yeah,
That's
so
brought up so many good points. I taught a seminar series with a neurologist from Cornell, and he says one of the things he said is doctors in this country suffer from testophilia, love of testing. There's no limit to what we can do. But with that said, what would you need to test if people were really doing everything right and listening to their body and having good, loving relationships? And that's really the key.
that is completely the key. It's like you just start looking at things from the wrong perspective. I mean, let's just take it something that's foundational. Let's talk about sleep. I mean, what kind of conversation do you have with your doctor about sleep? How many hours do you sleep enough? Yeah, I sleep like 7 to 8 hours. Okay, check. We'll go off to the next one. All right. So how about do you smoke? So literally, sleep gets nothing. And there are so many things that sleep affects. And then the main thing that I would like um, our listeners to understand is that you have to track your sleep. I mean, you don't have to be a biohacker. You don't have to be crazy. You have to be wearing your Oura ring. Absolutely. You have to track it. Because if you don't know the data, you don't really know. Sleeping is just it's so enlightening too. You sit there, you laid in bed for 8 hours, and then you actually slept for six, and then you had no deep sleep and very, very little REM sleep. Surprising, And so we've all been there where we've been sleep deprived for one day, and we know we've been sleep deprived, and then we just know that next day is just gonna be tough, and that's just from one night. So imagine if you're stacking months and years of sleep deprivation. What kinda toll is that taking on your body? How's that affecting your oxidative stress load and your mitochondria and, your cortisol levels? Oh, man, it is just slowly eating away at you. It's so insidious. But part of the problem, Bob, is we're not asking the right questions. We're not getting enough data and we're not asking the right questions. So we're missing all these people with sleep dysfunction. And even worse, we're getting them misdiagnosed with depression, or we're giving them sleep medications for insomnia, making the problem worse. So we're just in this continuous negative spiral that, we're not getting people better.
Well, Doc, I can't even believe we're already 30 plus minutes into this. What I want to know is how can people get a hold of you? What's the best way for them to get your book? You are clearly a voice of wisdom and reason and what our world needs. So, what's the best way to reach you?
Well, thank you very much, Bob. Two ways to reach me. I've my ecosystem website. It's really easy. It's kennethrowmd.com. So my name, md.com. And then my concierge men's practice, it's backinthegamemen.com. So backinthegamemen.com. And my book is Prime: Winning the Second Half of Life, and it's available on Amazon in paperback and ebook Kindle version. So yeah, give it a read. I'd be happy. Visit my websites. I'm also going to be posting some videos on YouTube, so people can kind of put a face to their name. And of course, things like your beautiful podcast is hopefully going to get my messaging out there.
Well, we're going to make sure that we do because it's a message that needs to be heard. So, everybody, thank you. Time always flies and we have so much information to share. And I like to wrap up with these words. I'm Dr. Bob Rakowski, absolutely knowing that we can all be happy, healthy, and successful.